part of two potheads that were into rock and roll, and Alice Cooper would come over and they would say, "I'm not worthy." So Mark, I'm not worthy. Thank you. So my presidential address relates to something that's dear to my heart, which is research, particularly research during our residency years. And before you all fall asleep, I'm gonna tell you what I'm gonna say, so then you can fall asleep or look at your phones. But basically my thesis is that we need to protect the research years that our residents have in neurosurgery. We need to not pay lip service to it. We need to actively make sure that those research years remain in our curricula for a variety of reasons, which you will hear later on in my speech. But that is what I'm gonna say. And before I go to this though, I want to really spend a little time with the society, and these are my disclosures, and talk a little bit about this society and what it has meant to me. When I came into this society, I realized that this is a society where there's volunteers. There's chairs, program directors, and educational leaders. We just roll up our sleeves and primarily do volunteer work on behalf of our residents and our fellows. And it's hard work. And we do a lot of different things, but we do stay in our lane amongst all the other societies in dealing with several topics. And so what we work on, clearly this annual meeting, we're finally live again, and we really get to talk about issues related to education, resident and fellow education with our committee on resident education, and finally our boot camps are going to be live again, the curriculum, QIPS. We work on CAST, the Committee on the Accreditation for Specialty Training, the Program Director Toolkit, and then also in the research arena with the RUN course, which has really been an exceptional course, teaching neurosciences to our residents. But also awards, we celebrate. So we provide a neurosurgeon new scientist training program, an STP award that really was worked by Linda and Costas, as I'll discuss later. And this is really to fund research in areas during the resident curricula, which I think are danger areas. That is, after you finish your research and you go back into your senior years, we'll still get you some money, especially for the best of the residents, to get a technician, for example, to continue research. And then we celebrate the best science with the Richard Wynn Prize. And this year we heard from Linda Liao, who gave a fantastic talk about her research. And finally, we coordinate. We coordinate the other societies. The One Neurosurgical Summit really gets us all together in one room to discuss issues of importance. We did this at the SNS, and we discussed the issue of AI, artificial intelligence. Who owns this? Which society owns this? Who's going to work on it? And finally, and not because they're the last year, but really errands, our residency coordinators, our residency administrators, which are an integral part of what we do. And so now I really want to thank the support group, the people that make this happen. And first of all, Nate Selden. Nate was the secretary of this society. He's not become a dean, he's not even a chairman anymore. But Nate was the secretary of the society for 5 years. Nate knows all the jewels in the society. He also knows all the skeletons. So he'll tell you, don't step in that. Because he knows the history of the society. Nate is going to be our president soon, and I really look forward to the job he's going to do. Judy was our vice president for the last year. I've appreciated Judy's demeanor, calm demeanor. We have these officer meetings every week, and she's the one that's always in scrubs. So I think she's the only one of us that actually works. But she always has the best answers, very calm, very level-headed, as you know. And then Greg. Greg is our secretary. He's taken over from Nate, and Greg now knows where all the jewels and skeletons are. So if there's anything wrong, you could talk to him. And finally, Linda. We heard from Linda yesterday. The comment was made that she has more letters after last name than her last name besides her last name. PhD, MBA, Liao, 4 letters. But that just shows, again, somebody that's really passionate about the society. She owns the treasury. If we come up with crazy ideas, and she's the one that tells us we can't pay for that. And so, she's really somebody that I'm really looking forward to seeing her go on and having more leadership positions in society, i.e. president. And finally, Lauren. Lauren is the administrator that comes to us from SNS, and she's really been the person that, together with Greg, has run the society for the last year and will continue to do so. And then for this meeting, I really have to thank our program committee. David Limbrick has done a yeoman's job putting this program together. I think we've really enjoyed the talks. I mean, this last talk was amazing. And Mark and Randy, we're gonna take over from David as he kicks off. And then finally our host, Phil, Mike. We were told you can't do this in New York, and you show us that you can do this in New York. So thank you. You have built an amazing department. We're so grateful that we're here. We're here actually on campus, which is also what we were told we can't do. And so this is really great that we've been able to do that, and maybe we'll be able to do it with other places as well. We have an entire executive committee composed of all these individuals. I can't go through all of them to tell you what they do, but you've heard from several of them. And then finally, I want to thank our other organizations, the CNS, Alex Galassi, the CNS president, Regina Schupak, the CEO, they've been here. The CNS has been our administrative partner for several years. And they really provide some of that help to us volunteers, physician volunteers that we need. And finally, Aaron's, where Sherilyn Pedersen was the president. There's a new president now. And again, they've become an integral part of this society. And I want to thank my personal support group. I go to work every day and I don't see that as work because I work with a fantastic group of colleagues and friends. This is my department of the Brigham. I'm not recognizing Mark's Department of Children's, but they've also been an amazing group of colleagues. But these are specialists, excellent people, great individuals that you really can rely on and depend on. And then finally, my family was mentioned. They say that beyond every person, there's somebody that supports them, and this is my support group. These are my friends. Charlotte in the middle. Charlotte has been my life partner for 28 years. She used to be a cardiac surgery ICU nurse. And I think when she married a neurosurgeon, she said, "You guys are easy." I deal with cardiac surgeons every day. And so she has been amazing. And my 4 wonderful, they're not kids anymore, they're young adults. And don't go party with them. You're not gonna live through it. But Andrew on one side, he's gonna be a junior at University of Virginia, wants to be, maybe he's majoring in neuroscience. Then Alex, his older brother, right next to him. Alex works in real estate and construction in Boston. Christina in the middle, she's the oldest, but she works for advertising and agency. And then to my side is Austin, who's gonna become a freshman at Northeastern in engineering. They're great kids. I'm gonna embarrass them. And my wife says, it's great that you left the house when you were little and you finally came back now, because that way I could raise them and they're good people. Because if you had raised them, there would have been a mess. So thank you for being here. So I'm gonna come back to my talk, which is why research. And when I say research, I mean research in all its facets. It's not just laboratory research, but also research in global health. We talked about clinical trials, anything that really expands the knowledge and breadth of what we do in neurosurgery. And in fact, as a mission statement for the society, we do say that we want to advance the quality of neurosurgical patients' care by promoting excellence, not just in education, but also research. So that is part of our mission statement. So we should abide by that. So when we talk about research, traditionally, it has been a dedicated time, usually in your PGY4 and PGY5 years, where residents could spend time pursuing a passion, a mission. In my time, it used to be just basic lab research, but nowadays our residents do all sorts of things. In some programs, this has been split into two separate years. In some programs, it's only 1 year. I do think you need at least 2 years. But this is what I'm speaking about, is how do we continue to protect that time? And there's some financial consideration, but if you look at the finances, I think we've been pretty good at research funding mechanisms. Back in the medical school, ABTA, NREF, and others have medical school grants for medical students. And then during the research years, as we will discuss, NIH has come up with these R25 programs that are very neurosurgically oriented. NREF has also possibilities for funding and others. And now with this neurosurgical scientist training program, we also can provide funding for senior residents to continue their research. And then as you go to junior faculty, there's the K-12, NREF as well, and other programs to really support this transition to independent research. So over my career, I've heard several arguments against dedicating years of protected research time in residency. And I've got to tell you that some of them sound great. In fact, sometimes I even think that myself. But I hear sometimes these from some of you and from some others. And the arguments have been, look, our training is already long. If we eliminated 1 to 2 years from residency by removing or reducing research years, this would alleviate this. Neurosurgical practice, for the vast majority of us, does not really require research know-how. You don't need to have done research to take out a lumbar disc. Practically, research again does not impact daily neurosurgical practice. If someone really wants to do research, they can always allocate time as an elective or take time off to do it. And most residents really do not accomplish much in their research years. So these are some of the arguments that we think ourselves sometimes, we hear about, and sometimes our residents tell us. In fact, sometimes residents end up doing clinical work anyhow, folded fellowships, moonlighting, etc. So, are we going to CRISPR out the research gene from the neurosurgeon DNA? And if you don't know what CRISPR is, it means you need to go do research. There are also lots of external threats to dedicated research time. There's this rise in ideas that we need to change our residency program to competency-based training, which I think will also eliminate the time that we have to do research. There may be further duty hours restrictions, but will also cause more pressures on the research years. And this issue of unionization, that may also impact the research years as we level off how training should be throughout each specialty. And listen, other surgical specialties have no or minimal research time. Urology, they do 6 months of scholarly activity. When I actually asked the chair of neurology at my place, of urology at my place what that means, he actually could not even tell me. And they do this as a PGY3 or PGY4. Ortho has no research requirements. Some programs will do it, or they'll allow maybe 1 additional year of research, but that's really pretty much like an elective. Surgery, up to each program. There's no mandated requirement. And I want you to just keep those 3 programs in mind because we will look some data later on to show what that means because you don't do this. And I want to say that our dedication, which has come to us from our forefathers, Bob Martuzza, Ralph Dacey, Steve Giannotto we heard, who I remember telling us, you have to protect research, you have to protect research. And I'm hoping that this message comes to you as well. And this is fairly unique among residency programs. But the question is it worth it? We've heard a lot about efficiency, cost cutting. What is the value proposition for research? And that is what I'm going to try to convince you of. First of all, in this age of equality, I still think neurosurgery is fairly unique. Among all the specialties, I think we're fairly exceptional. For what we do, for how we lead, we really are a beautiful unicorn. And I hope we stay that way. Again, this has always been part of our DNA. Even our founding father, Harvey Cushing, had a lab. He had a physiology lab. He studied the pituitary. He studied endocrinology and wrote about it. And we value research. Before and after residency, we highly value research efforts. Think of our medical students, the medical students that apply to our programs. This was an interesting paper that came out in JAMA Surgery 2022 about the ever-ballooning amount of papers and presentations that medical students have to have as they apply or they're applying to different specialties. Well, the one in red is neurosurgery. Over more so than any other program, our applicants have more papers, more publications, more presentations than any other specialty. And it's going up and up. And that is the people that we accept, the people that have done lots of research. And then our faculty. The faculty in our departments, we push to publish, we push to present. We heard the great presentations today from the Cornell group and everything that they do. And that comes from the chair pushing their faculty to do this. And we show that. Think how many journals we have. How many board-certified neurosurgeons are there? 4,000 board-certified neurosurgeons. We have more journals per FTE than anybody else. And we continue to have more journals per FTE than anybody else. We publish more than anybody else. And think how many societies we have. This is just a small little snapshot. We value going to meetings. We value talking about knowledge, disseminating knowledge. We want our faculty to do that. We want our medical students to do that. And so we need to have our residents do that too. And this is a lifelong activity. You will never ask a neurosurgeon to, do some spine or do some complex spine and then spend 7 years without doing complex spine and then go back and do complex spine. This is a lifelong activity. One of my favorite athletes is Tom Brady. I come from Boston. Tom Brady did this as a lifelong activity. He was a quarterback in his high school, and he won a Super Bowl as a Tampa Bay Buccaneer at the ripe old age of 44. But in between, he continued to throw footballs as a Patriot and won 6 Super Bowls. This is a lifelong activity. Doing research is not something where you can just stop, go back, stop and go back. You need to keep on doing it. Neurosurgeons need to do research because we're the ones that know the diseases and can come out with the cures of tomorrow. We make paradigm shifting discoveries. And when we make them, we actually don't know if they're going to be paradigm shifting. But these discoveries then change how we diagnose and treat diseases today. So you have a few papers. This is a 1995 paper from describing the first DBSs in the subthalamic nucleus for the alleviation of Parkinson's. And now that is standard of care. Then there's the paper in the early 1990s about coiling of aneurysms. Who would have thought that would have been something that we do, right? Back in 1990. I mean, our cerebrovascular surgeons would have rolled up their eyes when they saw this paper. That is now standard of care. MRI-focused ultrasound surgery, Frank Jolis, another neurosurgeon, that was his baby. And now that has become standard of care. And even genetics, my mentor, Bal Martuza, he described found the first loss of a particular part of the chromosome in acoustic schwannomas. And that is something we test for now. So we need to push this because we know the diseases. I think Linda said this yesterday. We know about these diseases, we know how to treat them, we know what type of research we need to do. We can't let others do this. Now I've heard, again, this argument, if we make residency research years and elective only for those interested in, i.e. DMD, PhD types, then we can do that. But I'm gonna say that we will lose residents that become interested in research only doing residency. And I'm gonna embarrass this particular individual, Kyle Wu. Kyle was one of our residents at Brigham. He came into our program, he had no interest in research, he had done very little, in fact, probably nothing. And he spent 2 years in research, we made him do it, working at Children's Hospital, he was not in my lab, it's Children's Hospital, and then at the School of Public Health, looking at surgical innovation. And he caught the bug. And then he went to Ohio State, and now he's working with Russ Alonso on novel clinical trial designs for gene therapy for diseases such as Alzheimer's and Huntington's diseases. These are not things that we usually treat, but they use convection enhanced delivery to deliver gene therapies in these patients. That could be the future, another future for us, another innovation. And ask Kyle to actually say this in his own words. Hopefully the audio will work. So he sent me this video.
My name is Kyle Wu. I am an assistant professor at The Ohio State University. When I started residency, my research experiences and interests were limited to clinical outcome studies. The 2 years of research provided me by the Brigham helped to expand my knowledge and develop a deep interest in translational research in biomedical sciences. I am thankful to use the skills and knowledge I developed during these research years to now study and pursue gene therapy and direct convective delivery techniques under the guidance of Dr. Lanzer.
So these are the people we will lose. And there's several like that that I've encountered in my career. We're gonna need our residents to write the algorithms for AI, for virtual reality. We're gonna have a great session tomorrow. I hope some of you can stay for that, related to virtual reality and AI and how we can do this in education. But these beautiful pictures, combining all sorts of things in the brain to try to figure out, they got this brain tumor using simulation to look at different approaches. Those are happening now. You can see them now, but there's going to be so much more. And we're going to need young, smart minds that are neurosurgeons to do this for us. So what have we done as a group, as organized neurosurgery, as an NIH, to really provide the funding for research? And I think we've actually done quite a bit. And this is a paper that was quoted before by Russ and Steve Korn and others, talking about this comprehensive approach to coming up with funding for neurosurgeons specifically. So this is the R25 program that funds neurosurgical residents. And this was started in 2009. And then the K-12 program that's really for junior neurosurgical faculty as they come into practice that start in 2013. This is really sort of for them to jump to get then a real K award or potential an R1. And we've seen this data from this paper where, again, if you add an R25 as a neurosurgical resident, your chances of then getting a K-12 were much higher. And then if you then got a K-12, your chances of going to get a true R01 were even also higher. And this is data up to 2019. And so I asked Steve Korn and his team to show me if this has continued. And we have data as well after 2019 to show that that is true. And the punchline is that 73% of all of our K-12 scholars then go on to receive subsequent major funding. This is a great program. This is a great set of programs that the NIH, NIDS, and others are really coming up with to really support us, neurosurgeons, in doing research, our young faculty doing their research. And we've all seen this data from Russ's paper showing that amongst all the specialties, we are the one that has had the most significant change in funding since the implementation of this program. So you see these curves here where they just go up after the implementation of these programs compared to all the others. And I actually asked Steve again, is that true? This came up to 2019, is that has remained true even during the COVID years? And the answer is yes. Even during the COVID years, up to 2022, the number of neurosurgeons that have had unique R1s, or the number of surgeons that have had unique R1s, that keeps on going up. Also looked at other literature, so this is not neurosurgical literature, this is actually from BMJ Open. And here they looked at NIH funding between different medical specialties between the years of 2011, 2020. And neurosurgery is number 5 on that list in terms of the average dollars of funding, NIH funding per active physician per year. Above us is pathology, neurology, medicine, psychiatry, and then neurosurgery. We're above all the other surgical specialties. Even the ones that don't have any research, like orthopedics, number 15. Where's urology? Number 12. Surgery is number 8. You know, these are the specialties that don't have any dedicated research time during their residency. And again, in this paper, what they show is the growth of the number of uniquely funded neurosurgeons and the percentage of funding. And again, we are there with medicine, neurology, and psychiatry. We have the highest amounts of R1 and EO1 funding per physician. For those of you that don't know, an R1 or EO1 is sort of your ability to get independent funding from the NIH. That is what your promotions committee look at, and it's almost like a little imprint that you are a good investigator. Your peers think that you're a great investigator. So I really want to call out Costas and Linda. You know, they've come together and they're, you know, raising money through various foundations for this Society of Neurological Surgery program, the NSTP program. This started last year, and they've really been providing funding for residents. And I think, again, this particular time, after you finish your research year, you go as a PGY6 or PGY7 to do senior years. That's a little bit of a dangerous time, perilous time, because research could flounder. But having a technician, and that is what this does, could really help that period of time so that you can continue doing research even as a senior. And that is basically what we do as faculty, right? We're busy clinically, we're busy administratively, we educate residents, and we also have labs. So I think the data so far shows that the NIH and organized neurosurgery to NREF, NSTP, SNS are really fostering the funding of neurosurgeons to address innovation and research. And so I think we're doing something right. We're our current models of research training. And I just come back to the usual say, if it ain't broke, don't fix it. And that is my plea to you. Let's try to save these 2 years in whatever form we can to allow the independence of our residents to pursue their research efforts. So I rest my case. Thank you. We have a few more things on the program.